Welcome back to my channel. In accordance with your request, I made this video. Now, RPT design seems difficult, but it isn't. To understand this, you must have your concepts cleared, by which I mean crystal clear. And that is why you must first watch my video on indirect retainer. So you get a long answer question on this. I'll discuss some basic points and principles for design which will really help you. So carry a notebook and jot them down. Towards the end of the video, we'll also discuss how to frame answers for such long answer questions, and I'll share my notes. So without further ado, let's delve into this topic. As a matter of fact, RPT designing is a complex thing to do, and there are so many factors that have to be taken into consideration before giving a design. The choice of class, major and minor connector depends on so many factors. Ridge form, abutment, vestibular depth, and this also requires surveying that for creating guide planes and locating undercuts. And the location of undercuts again changes our preferences for clasp. But to make this simpler to understand, I created these 5 design principles, and these are: if you get a distal extension case, that is Kennedy's class 1 and 2, that means you need indirect retainer. So first thing, you are going to locate the location of indirect retainer. And how do we do that? We already discussed this in my video. You draw a fulcrum line along the most posterior abutment teeth, and perpendicular to that fulcrum line gives you the location of indirect retainer, that is rest. There are many forms of indirect retainer, but you will only use rest. Now we need direct retainers or clasp assemblies, but the choice of direct retainer is RPI in case of distal extension. So this RPI will be placed on the last abutment tooth adjacent to this distal extension case. Here it's the premolar, if you can see in the first picture. So we'll give RPI as direct retainer in this case. Rest will always be mesial as a distal extension case. Again, we discussed this in our video, the reasons for using a mesial rest in distal extension case. And we'll have proximal plate and the eye bar. So note this down: if you get a distal extension case, you will need indirect retainer and a direct retainer as RPI. If it's not a distal extension case, then you know this basic principle: we place rest adjacent to the edentulous area. That is in Kennedy's class 3 and 4, and no indirect retainer is needed in Kennedy's class 3. The choice of our clasp will remain simple circlet or circumferential clasp, whereas in Kennedy's class 4, will need embrasure clasp. So direct retainer is this, it's a unit actually which has rest, retentive arm, reciprocal arm. And direct retainer in distal extension cases rest, proximal plate and eye bar. The choice of major connector in maxilla, you will draw the complete palatal plate major connector, or you can even draw anterior posterior palatal strap, because the advantage to this anterior posterior palatal strap is, as the hard palate has minor salivary glands and taste buds, and taste perception diminishes with age, so this has an additional advantage to this. But you can draw complete palatal plate major connector, and if the edentulous area is short span, then you can give a palatal strap. And most commonly used major connector in mandible is lingual bar. There are lattice type and meshwork type minor connector. Lattice type major or minor connector is commonly used in long span edentulous areas as it provides retention and helps in acrylic packing. Meshwork is used in short span edentulous areas. So complete palatal plate major connector is commonly used for maxilla as it provides good coverage, and palatal strap can be used if there's just short span edentulous area, because the principle says that we have to minimize the components and not provide unnecessary coverage. Assuming you are well aware with the design principles, we move on to the cases and apply them. Okay, so we have this case of Kennedy's class 2 modification 1. First thing, we draw the fulcrum line, and perpendicular to that gives us the location of indirect retainer. Fulcrum line passes along the last posterior most abutment teeth, and perpendicular to that gives us the location of indirect retainer. As we know, this is a distal extension case, that is, we'll need indirect retainer, yes. So we'll place rest on the canine which is perpendicular to the fulcrum line. Then for retention, we give this direct retainer, that is, we are using RPI on the most posterior abutment teeth adjacent to the distal extension area, and rest will always be mesial because this is a distal extension case. So, and the choice of a direct retainer distal extension case is, if you remember, RPI. And we saw in our video the reason why mesial rest is preferred in distal extension case. And oh, I forgot to tell you, this is mandible. So the choice of major connector will be lingual bar. And in the edentulous spaces, we'll give a lattice minor connector. Lattice is always preferred as it provides good acrylic packing. You know, this is the place, this is the place where the acrylic will sit, acrylic with artificial teeth on it. Hence, we need to provide these large holes for proper retention or packing of the acrylic. This is why lattice is always preferred. But if you have very short span edentulous area, then you will give a minor connector as meshwork. Once you know that this is a distal extension case, so you draw a fulcrum line and perpendicular to that you give indirect retainer as a rest. And then on the abutment teeth adjacent to the distal extension, you give RPI with mesial rest. Mesial rest is preferred in distal extension case. And usually you place mesial rest adjacent to the edentulous area. So that is why you have placed a rest on the molar tooth mesial, or say adjacent to the edentulous area. This is our final design. We have lingual bar as major connector, lattice type as minor connector. You can also draw tissue stops because this prevents distortion of framework during acrylic resin processing procedures. So we already discussed this, that the ladder type or lattice type is preferred for distal extension case or long span edentulous arch because this has large holes, so this provides more retention. So in Kennedy's class 1 and 2, probability for bone resorption is high, which will require frequent relining by acrylic. This is why in distal extension cases, lattice type minor connector is preferred. Next is we have classification 3, modification 1. Well, class 3 is the easiest. And the basic rule is we place rest adjacent to the edentulous area. And in Kennedy's class 3, the edentulous arches are well supported on either side by the abutment teeth, so no question of talking, hence we do not read indirect retainer here. This is the easiest case of all. So we place the rest adjacent to edentulous area with retentive arm and reciprocal arm, and the choice is simple circlet or circumferential clasp in Kennedy's class 3. Now here we needed 4 direct retainers, but the trick is you need to keep this in mind in Kennedy, but this is not always true. Again, this is not universal. For Kennedy's class 3 and 4, all the abutments are used for direct retainer. Okay, maximum 4 are used. And in Kennedy's class 1 and 2, minimum 2 are used. You can use this trick if it's a Kennedy's class 1, 1 plus 1 and 2. That means you might need 2 direct retainers. If it is Kennedy's class 2, 2 plus 1 is equals to 3. That means you might need 3 direct retainer. But then again, that depends on case. This is Kennedy's class 1. Again, a distal extension case. So we need to draw fulcrum line. Perpendicular to that, we'll draw indirect retainer. We discussed this in video of indirect retainer that ideally indirect retainer should be far away from fulcrum line and anteriorly placed. And the ideal location for indirect retainer in Kennedy's class 1 is incisor region. But incisors are weaker abutments compared to canines and premolars. Hence, canines are always preferred. But the fulcrum line is very close to incisors, and in order to compensate for this compromise in distance, we give 2 indirect retainers here on both the canines. Since it is a distal extension case, the mesial rest are placed as indirect retainers on both the canines, and RPI direct retainer will be given on the last abutment teeth as it is a distal extension case. So rest is mesial, proximal plate and I-bar. So RPI is the best choice for distal extension case as a direct retainer. You'll get the simplest cases for exams, but exams are so uncertain and expect the most unexpected in exams. So we'll discuss every possibility. Hence, I'm discussing every case here. This is Kennedy's class 4. As the patient bites down on the RPD in the anterior part, it will live from the posterior part. That means we need to draw imaginary fulcrum line because there will be torquing when the patient bites on the anterior part of RPD. Hence, we need to give retention. And how do we give that retention? Is by giving direct retainers. The most posterior direct retainer will make the prosthesis more stable, hence, the farther the better. The direct retainer placed farthest provides more stability. If you see in the diagram, the retention provided by retainer 1 is more stable than retention provided by retainer 2. We know this principle of our design that we place rest adjacent to edentulous area. So again, even in Kennedy's class 4, we'll place rest adjacent to edentulous area, that is on both the canines. The design for Kennedy's class 4 differs a little bit. We place embrasure class between two adjacent abutment teeth and a distal rest on the most posterior tooth. Here's the design for Kennedy's class 4. And we give some holes in the anterior area for packing acrylic. Anterior posterior palatal strap is most preferred for maxilla. An embrasure clasp is placed between two adjacent teeth to provide retention, that is, double occlusal rest. This was the question asked in 2016 for Winter's batch. So you will be given teeth present and teeth missing, and then you have to draw a design for this partially dentulous arch, mention each component, and justify your choice of clasp or retainers or connectors. And this is the format on how you should answer this question. I hope you found this video useful. With this, I end this video. Thank you.